Hello, hi, I'm Dr. Gurung. I'm a consultant psychiatrist. Today, I want to cover on an interesting topic, communication. Communication doesn't just means whatever we speak. Communication in the modern world have taken different forms. Communication can be a written communication. In a digital world, communication might be the way you text, the way you post, and the way you show yourself. Communication also takes different forms, not just the vocal communication. It also takes into account your body language, which is all the form of communication. So in the topic of communication as a psychiatrist, this is my bread and butter. Just want to discuss how to have effective communication. Communication is one of my hobby, and I tend to read a lot of books. Also, tend to do a research and go through a lot of podcasts where I analyze people who does the podcast as well as able to communicate. I watch a lot of TED speaker, and just to distill just a few things which I've learned about communication. Number one of communication is you need to know your strength and weakness on your communication. Let me give you an example. What I've realized in terms of my communication is I don't have much of a facial reactions, or sometime me being happy, sad, or the expression doesn't come naturally in my face. But what I tend to do is I tend to play with my vocal tone. With my vocal tone, I tend to modulate it. For example, if I have to tell something which is very important, I tend to give a stress. And I tend to fluctuate my vocal tone to match or mirror the person that I'm talking to. This is one of the things that I've noticed. The other thing is I also feel comfortable to play with silence. The other thing I just also want to say about communication is when we communicate, we also need to know the wavelength in which we are connecting with people. When we are connecting with people, what I've realized is, in a simple term, there are three things that we connect with people. If you take an example in a school, if a kids come to you, you just the teacher tends to ask to the kid what you want. Number one, do you want a hug? Do you want to be heard, or do you want to be helped? So there might be three agendas in which the communication might happen. And just to further enhance it for a communication, you also need to, first of all, set the boundaries. In setting the boundaries, the number one thing is you need to know the ideas and expectation of what the other person needs. And keep in mind, the communication can also take into different forms. So you need to be aware of the place, situation, and the agenda that you want to discuss. Just to give you an example, this is one of the thing that which I find it interesting. So this is the thing that happened in US. Permanent surgeon wanted to have a conversation with the patient. If you look at an example of someone having prostate tumor is a very slow growing tumor. There's a thing which is also a truth. The prostate tumor go in such a slow rate that the old people might die of old age more than the prognosis or the growth of a prostate tumor. The normal treatment for prostate tumor is wait and watch, surveillance, and to do regular test, just to see whether it has grown or not. And even if you do a surgery, the risk of surgery are erectile dysfunction, and the chances of surgery are not that great if you look at the prostate tumor. So this particular surgeon, knowing the expertise and the fact, he used to give all the facts to the patient without taking into account of ideas, expectation, and knowing um, what the conversation is. So after providing all the information, what he realized is most of the patient opted out to have risky surgery. So this is what he found when he did a quality improvement project. So after he struggled to understand why people were not willing to listen to the fact, the thing that he understood was um, it's the communication that made a difference. So in the next patient that he have seen, rather than giving all the facts, what he did, the first thing was he just asked, what is important to you? What does prostate cancer mean to you? So that particular patient said that his father died from cancer. He was also cautious about his self-image, how his colleagues or family is going to take him, knowing that he has got a cancer. He also had the self-image about him. So these were all of the things that was bothering him about cancer, and he wanted to have a surgery. So when the surgeon gave a time for the patient to listen, so this particular conversation, it was not about help. It was about heard and hug. So knowing um, what the topic is, the surgeon was just kept quiet and listened. So throughout this, he was able to relay the emotions of the patients, and following that, he provided all the information. The outcome was the patient didn't want to have a risky surgery. So you can see communication can make a big difference in the outcome of the conversation that we uh, can have. Now, the take home message is we consider that having a high intelligent quarter helps to resolve everything, but we also need to be aware intelligent or a quarter or ability can take into different shapes. For example, someone can have a high emotional equity, someone have high social equity. So, depending on the where the game is, you need to play. Okay. So just to summarize the thing which I have discussed about communication, number one thing is whenever you communicate with someone, know your strength and weakness of your communication. Number two is always ask about ideas and expectation. Number three is know the agenda that you are discussing, whether it's a hug, hurt, or help, and always reflect to think what are the things that you are doing good, what are the things that you can improve. So this will help you to enhance your communication. Thank you.